Incidence and Determinants of Bacteremia Among Patients with COVID-19, a project by T. Fawn, M. Hines, A. Potnick, S. Wing, K. Garrison, L. Hostetter, R.M. Estrada Martin, G.M. Eisenberg. This was conducted within the Department of Internal Medicine, McGovern Medical School, UT Health in Houston. Background on the topic. Fever and sepsis are frequent among patients with COVID-19, and due to the mortality of sepsis, physicians will often empirically prescribe antibiotics. In a 2020 U.S. multi-center study of more than 400,000 hospitalized patients with COVID-19, concurrent bacterial infection was close to 1%. Among those patients, bacteremia was uncommon and its determinants were not evaluated. Obtaining blood cultures in patients with COVID-19 remains controversial, from overutilization to delay in the diagnosis of bacteremia. The purpose of our study is to report the utilization of blood cultures among patients with COVID-19 and the determinants of a positive result. Methods. A retrospective database was created for all patients who tested positive for COVID-19 at Lyndon B. Johnson, a large safety net hospital in Houston, Texas. The data was collected between March 29, 2020 and January 29, 2021. We recorded the number of blood cultures drawn per patient and their positivity yield, as well as the following data: fever, leukocytosis, neutrophilia, lymphopenia, central venous catheter, pulmonary opacity on chest x-ray, reported sepsis, and mechanical ventilation. We accounted for other known infections. We assessed if antibiotics were started empirically or for a suspected infectious source, and if so, for how many days. We determined which variables were significantly associated with positive blood culture using logistic regression. P less than 0.05 was denoted as significant. The database included 1,217 patients with COVID-19. The baseline data is broken down into percentage seen in Table 1. The most common variables were pulmonary opacities in 62% of the patients, neutrophilia 60%, and fever 42%. A total of 1,172 blood cultures were drawn from 594 patients. This averaged to be 1.97 blood cultures drawn per patient. The full breakdown is highlighted in Figure 1. Of all the blood cultures drawn, 15% were positive. However, only 7% were deemed true positive and 8% considered contaminant. All 52 bacteremic patients were treated with antibiotics empirically, though the antibiotics only matched in vitro sensitivity in 61% of cases. Table 2 shows all the isolated microorganisms in 36 patients, with an even split between gram-negative and gram-positive. 15 isolates each. The remainder were polymicrobial and yeast. Table 3 compares variables between patients with positive and negative blood cultures. The length of hospital stay was significantly longer, and mortality was significantly higher among those who had positive cultures. In a logistic regression, sepsis and mechanical ventilation were statistically significant in their association with bacteremia. Conclusions and take-home points. Our data is in line with other studies that have also found rates of bacteremia between 10 to 20% and a high degree of contaminants. Our results, 15% bacteremia and 8% of those contaminants, echo those findings. Despite low rates of true positive bacteremia, empiric antibiotics were often prescribed, and 39% of the time did not match the sensitivity of the isolated organism. While limited by its retrospective nature, our findings suggest a need to 1. Refine the use of blood cultures to minimize empiric antibiotic use, and 2. Target those with expected higher yield of blood culture positivity. As seen in our case, those who are mechanically ventilated or are known to have sepsis.